Now what we're going to do now is similar, but we're going to do that with a straight leg. Okay, now this is very useful actually even in hypermobile patients, let alone restricted patients or even sciatic patients, because you really can allow, if they're hypermobile in their lumbar spine, to actually get more movement. Now actually in about, I think the straight leg raising test I was reading just up again today in hypermobile lumbar spines actually is very ineffective because there's so much movement in the spine. But this engagement is incredibly powerful. We don't hold it for this long because I'm talking, and you bring that leg nicely backwards, but without the elbows separating. So you've got to keep those together. Yeah, knee straight, that's great. Okay.
Run that past me again.
Right.
The straight leg raising test is, as it says, a test.
Yeah.
Now, are you testing for exactly the same things in this position in a hypermobile spine?
Exactly.
So, the ranges of motion would be similar to those on the diagram that we haven't shown anybody yet?
Yes. I mean, but you're also getting extension to see, A, if there's any compression, and B, really, to see really how the quad and hamstrings are balanced or not balanced with the pelvis. Yeah, you can actually see that very quickly. You can feel when there's a block that the elbows, that we keep talking about, start to separate, because actually you're starting to rotate, which we're going to stop you doing, to make more range of movement. Yeah, so if you lift that elbow, you'll immediately start to rotate back further, and we don't want you to. We want to see, and also if you're over-engaging your core, and I'm not into the core exercise thing, but if you're over-engaging or using your iliopsoas and so on to do deep exercises, you start limiting your hip range. Yeah. So yeah, that isn't a great thing.